In this video, I'm going to talk about salt and water supplementation in regards to the autonomic nervous system and how to do it. So often patients who come to see me in clinic or who've seen other doctors who are dealing with autonomic disorders, they are advised to increase the amount of salt and water in their diet. And in this video, I'm going to explain why we advise that. So for patients who have orthostatic intolerance or POTS or frequent fainting, where they're just intolerant of being in the upright position and they can't exist in the upright position without experiencing symptoms of dizziness or lightheadedness or palpitations. Sometimes they'll get brain fog and fatigue that are significantly worse when they are upright. Well, studies show that they often exist with a lower blood volume than people who don't experience those symptoms. And that is one of the main reasons that salt supplementation can work really well. By increasing the amount of salt in your diet and the amount of water in your diet, you can expand your blood volume, and thereby sometimes the tolerance of the upright position can become much better and can give significant relief of symptoms. Another mechanism by which salt and water can improve your tolerance of the upright position is through increasing your vascular resistance. The vascular resistance refers to the constriction of blood vessels in the legs and in the abdomen, and it is shown that people who suffer from orthostatic intolerance or disorders like POTS or frequent fainting often have a lower vascular resistance than people who don't have those symptoms. And by increasing the vascular resistance, or by giving salt and water, the vascular resistance has been shown to increase up to the levels that are similar in people who don't have any of these symptoms. A third way in which salt supplementation can improve symptoms in these types of disorders is through improving the blood flow in the brain. So that's really interesting because a lot of patients do report symptoms such as brain fog. And it has been my experience clinically in patients who have responded to salt and water, if they have the symptom of brain fog, this also tends to improve. So it is thought that salt supplementation can improve both the blood flow in the brain as well as in the periphery. And then that just means that when you are upright, your brain blood flow is less challenged by the orthostatic or the standing up stress. So there are three ways in which salt supplementation can improve the symptoms of a dysautonomia. Now, when it comes to treating someone with salt and water, it is important to talk a little bit about the safety, because we are far more familiar with being told to avoid salt in our diet and that salt can lead to high blood pressure, and that is the case in certain patients. However, when it comes to patients who are young and otherwise healthy and have a symptom such as POTS, or a condition such as POTS, orthostatic intolerance, or frequent fainting, they actually respond really well to salt, and the studies show it is very safe. It doesn't tend to lead to high blood pressure over time, and it doesn't lead to high blood pressure in the lying down position, and those are two important factors to consider in increasing the salt in anybody's diet. The patients who are most likely to respond to the salt supplementation are those who actually have a low salt diet, but it doesn't mean you won't respond, and it is worth trying if you do have these symptoms and again you don't have any other ongoing medical conditions. When it comes to actually the giving of the salt, it is given either orally, and that is the preferred option. So my advice to patients is to weigh out 1.5 teaspoons of salt in the morning, and then to add that to their food throughout the day. So that's between 5 and 8 grams of salt. So this gives you an extra 120 millimoles of salt per day, and over a number of days this will increase the volume by 200 millilitres, which is felt to be a clinically relevant increase in your blood volume. Now, it is important that this salt is given with water, so obviously not the salt dissolved in the water, but that you would drink between 2 and 3 litres of water per day if you can, in addition to the salt. There are some patients who have been given intravenous normal saline as a means of expanding their blood volume. And while this does work, it is thought it works more because you are adding volume through the litre of fluid that you're giving, as opposed to adding a significant amount of salt. So the intravenous saline will work and it will improve symptoms, but it really isn't a practical way of managing these symptoms. Patients who suffer from these conditions tend to be young, they're either in school or they're in college, and it simply isn't conducive to normal life or in any way practical to be getting a litre of fluid intravenously a number of times per week. It also involves the insertion of an indwelling intravenous catheter, and this can increase the risk of infection. So certainly wouldn't be the go-to option if someone is suffering from symptoms. Now, it does have a role if someone has a dramatic deterioration or worsening of the symptoms. For example, if they had a severe infection or any other reason that their POTS or orthostatic intolerance had significantly worsened, then intravenous normal saline may have a use in terms of just kind of managing the symptoms in the acute phase, but it certainly wouldn't be your first line of treatment in trying to increase the blood volume. When it comes, again, I was talking there about the patients who would be most suitable to receive salt and water. It really is that younger cohort of patients. There is an older cohort of patients who also suffer from autonomic disorders, and they more suffer from a failure of the autonomic nervous system, and so their symptoms would relate more to the blood pressure not being able to be maintained in the upright position, which is called orthostatic hypotension. Their medical condition is a bit more complex in that they wouldn't necessarily be advised to increase the salt and water in their diet, or if they are, it would be done under close medical supervision. The advice in this video mainly relates to patients who are younger, who are healthy, who have no other ongoing medical issues and are suffering from disorders of orthostatic intolerance and POTS. So that's just a quick run through of how to increase the salt in your diet and why we do it, and I hope that's of use.